President Donald Trump's signature legislation passed the Republican-controlled Senate yesterday with a 50-50 tie broken by Vice President J.D. Vance. Now the bill heads to the House of Representatives, where Hawaii Congresswoman Jill Tokuda joins us now live from Washington, D.C. Aloha and good morning, Representative. Thank you for stopping by with us.
Good morning.
What do you
I
make?
apologize. I'm literally in a stairwell right now, right off the floor of the chamber.
Yeah,
so,
very busy morning for you at the House of Representatives. What do you
Yes.
make of this version of the bill that passed the Senate yesterday?
You know, the really sad part is I didn't think this bill could get uglier, but it's actually gotten much, much worse since it's left the House in terms of the pain that inflicts from robbing everyday Americans of health care, of food money, of educational opportunity, literally jobs for construction, for energy projects, for farmers, quite frankly, all of these different things. It's actually way worse than it left the House. And it's a hell no for me once again on this bill.
One of the things that it also does, and it is a very big bill, is it adds more to the deficit than the version that left the House. The CBO projects that it's at $3.3 trillion. Obviously, lots of House Democrats are concerned about that, but some House Republicans as well. Do you feel like that's a sticking point for some of the holdouts from the Republican side?
You know, you would hope so, because we have a lot of folks here on the Republican side that call themselves fiscal hawks, that say that they're really about, reducing costs and the burden that we pass on to our children. 3.3 is actually on the lower end in terms of trillions of dollars of deficits added. I have heard estimates as high as 5 trillion or more over time. And think about this. $5 trillion added to our debt at the same time, removing $1 trillion from healthcare, Medicaid, and Medicare, taking away hundreds of billions of dollars from food money. So on top of literally robbing the poor to pay for billionaires' tax credits, we're also going to be saddening our children and grandchildren with trillions of dollars of debt going on into the future. And so I would hope for anyone who dares call themselves a fiscal hawk, that they not only pause, they not only complain about this bill, but 4 brave Republicans who find the courage and the heart to vote no can stop this big, ugly bill.
Yeah, one of the concerns also with the deficit is obviously cost of rates, mortgage rates, et cetera, that might go up. You represent Congressional District 2 here in Hawaii, lots of rural areas. One of the things that a lot of people have a concern about is rural hospitals with Medicaid, right?
Yes.
How do you feel like this could impact Congressional District 2?
I co-lead the Bipartisan Rural Health Caucus, and this will have a strangling effect on our rural hospitals across the countries, especially in Hawaii. When you take a look at the percentage of the Medicaid population that go to our rural hospitals, our federally qualified health centers, they're upwards of 50%. And so how long can they keep their doors open if they see these kinds of cuts to both Medicaid and Medicare? And also keep in mind, if people lose their coverage, we will see a significant rise in uncompensated care. So it's not only going to hurt the rural hospitals, it's going to hurt establishments like Queens Hospital and Kapiolani Health, Hawaii Public Health Systems and Kapiolani. So this is severely going to impact our ability for our hospitals to keep their doors open, to continue to provide services that we need in our communities, on our islands. I've talked to many of them. It's a dire situation in terms of whether they can keep the doors open for weeks or months or to the end of the year. And that should be concerning for every one of us, even if you aren't a Medicaid or Medicare recipient.
Have you heard anything from, especially Republican side of the aisle, on whether this is a bill that came from the Senate that they want to pass today, or is it something that they want to add amendments to pass back to the Senate?
We've definitely heard a lot of objections from House Republicans about what came back. But, the real proof is in the pudding. Let's see how they actually vote on this. If they truly don't like adding to the deficit, if they truly are concerned about healthcare and Medicaid being cut from their communities and rural hospitals closing, then there is one option for them. They have a choice. They need to vote no. And again, it doesn't take many of them to vote no and to make a difference on this particular bill. And so that is what the debate is. That's what the fight is right now on the floor, is to get Republicans to see the real human tragedy and loss in this. And again, who are we really helping? Who are we helping here? It's the billionaires. And we have to remind ourselves why. Why would you vote for this bill when you're hurting your people? And there is no deadline. There's no hard and fast rule telling us that by the 4th of July, we should give billionaires a great celebration on the backs of working people. And we're here to say no and fight against it.
Representative Jill Tokuda, very busy morning for you. Thank you so much for carving out some time to speak with us.
Mahalo.
Aloha.